Philippine President Rodrigo Duterte has declared a lockdown of the capital Metro Manila
to raise its COVID-19 alert to the highest level,
during which the movement of everyone will be significantly limited.
Nakadungog mi aning COVID ni adto pang February. Nya murag layo pa man kayo to kay gamay rang positive. Nya kasagaran gikan biyahe.
On January 30th, Philippines recorded its first COVID-19 case in Manila. Unbeknownst to many, the virus would manifest a month later with over 100 cases spread across major cities. On March 16th, President Rodrigo Duterte locked down major cities like Cebu to curb the outbreak.
Nahadlok ni pagkahibaw nga quarantine kay unsaon na lang among panginabuhi.
Non-essential industries closed or implemented work-from-home programs. Public transportation was suspended, community events postponed. While many Filipinos could take necessary precautions, the urban poor could not. Christy Baho from Cebu is one of them.
Akong mga anak diri tanan upat. Akong mga igsuon diya sa babaw. Tulo ka buok, wala sila trabaho. Ang akong mama na dito sa Manila na lockdown.
Needy families were forced to stay home even if it meant being cramped together in spaces no larger than the standard bathroom.
Padud sa una, taga diri na jud mi. Nga akong maigsuon, dagko na lang mi. Na jud Japan mi dinhi. Nya kana among gipuy-an dinhi sa among balay, at baboy jud na siya sa una. Kaya akong iyaan nagbuhi magbabuyan nya karon kami nalay ni pulik amo lang gibaligi tarong-tarong gamay gisimintuan og tarong dagan man mananap.
Around 20 million Filipinos live in slums, where they have to survive poor housing conditions, lack of sewage facilities, and little to no access to clean water.
Grabe kalisod kay sa una makatrabaho man ko jutay laba-laba niya ako bana manika dito makakuha og 300 4 may na lang kay makasudan-sudan mig mga manok yung na siguro nya lisod so nakuha ning coronavirus di ko kalaba-labag tarong nya di ko kay ko kalihok-lihok ang lisod jud nga adlaw na magatang kuan walang-wala jud mi oy. Sobra ka walang-wala para itong sus, wala dyan makaw ng mga anak. Nya, sige dyan miglugaw, maingon ang mga bata man, sige lang taglugaw, ani.
Local government units struggle to take care of thousands of families. Philip Zafra, a city councillor, headed relief operations in one of Cebu's main villages.
Regardless of economic strata, everyone is affected on this. But as to the impact, so mo na ningon ng gobyerno nga katulag yung pinakalisod atong tagaan. We are also preparing to provide them the provisions, the basic necessities and essentials.
Nagsalig ra pod mi sa ayuda sa barangay. May na lang pod at least naibugas. Pero horot na jud among sardinas. Wala na kay misudan jud. Ang pamaagi na mo karon kay ano. Daginuton lang kung ano, na mga dilata, na bugas, amoy igo-igoon sa mga bata. Kay lisod po ang mga bata way kaon.
When desperate, Christy resorts to stealing vegetables from her neighbors. Although the government promised cash assistance for the needy, when we met Christy in April, she had not received any money. Only relief goods that came weeks apart and in waves.
But we know for a fact that the government cannot sustain the same if we will reach up to how? 5, 6 months or 1 year. That's one thing that our medical expert vis-a-vis our economic team should look into more seriously and focused because unsaon na to pag ingon ta sustain sa atong ekonomiya nga without risking the health of the people because we could not just be placed for so many months under ECQ.
Under the Enhanced Community Quarantine, or ECQ, each household had one quarantine pass, enabling one family member to go out for essential goods and services. Residents found outside without a valid reason could be fined, jailed, or made to do community service.
Kung madakpan sa tanod, madakpan sa police, then we have to really put them on cell. Pero kung dili, ang gibuhat, atong gi-encourage ang atong citizenry to take pictures of them. Then, akong i-post sa akong FB. Haron said, makuli lang attention, at the same time, mauaw sa sila gamay.
But for some urban poor, they'd rather get fined, arrested, or shamed online than stay hungry or cooped up in homes that become furnaces during humid summers where temperatures can hit 41 degrees Celsius.
Maglisod mi kay walay tarong nga supply sa tubig. Gamay among balay, sikit-sikit pa jud mi. Unsaon man na nga kinahanglan man mi mogaws para na ami makaon. Wala pod mi mapalitan og face mask diri.
During the lockdown, surgical masks and sanitizers were severely in lack, even in hospitals and healthcare centers. And for people like Christy, these vital items were too expensive. This lack of protection worries experts, as they fear many cases are going undetected.
So if there's no testing in a community, the no case just means that no one is detected as of now. So I think that should put things into context, that we should be at a heightened alert.
The Philippines has one of the highest COVID-19 mortality rates in Southeast Asia. Early detection could help curb the outbreak and prevent more deaths. So the government has set a goal to test 1% of the population, slightly more than 1 million people. In Cebu, authorities are strategically testing at least 10% of the population, or 23,000 families.
We would rather that we will conduct the testing on the densely populated areas. Katong walay fence nga balay, no? Katong sikit kay nga balay, kay kana may lisod kaayo nato nga i-address. If simbako na positive on a well-off area, subdivision perhaps, mas ma-contain man nato.
Slum areas really are a big problem. We are actually expecting it to increase once we expand testing. But good thing now is that the local government unit of Cebu and other cities are admitting to that particular reality, and they're actually looking for sites that we can convert into isolation facilities or temporary treatment and monitoring facilities.
Samples are taken, but results have been delayed as the labs have not been able to keep up. And for the low income, getting tested is a risk.
Admittedly, ang idea of healthcare is healthcare consultation equals cost. PhilHealth has already issued a particular package for COVID-19 cases, be it moderate, severe, or mild cases. So that's something na should be take the anxiety of our urban poor communities if they eventually become sick.
But many are still not assured. PhilHealth, the national health insurer, previously bore the full cost of COVID-19 treatment. Then in mid-April, they announced that only subsidies will be given. That's not the only sign that Philippines' healthcare system is straining under the weight of the pandemic.
I am Dr. Vico Angelo De Leon. I am an anesthesiologist. I am the one responsible for intubating critically ill patients, COVID-19 infected patients. This process of intubation is a life-saving procedure. However, it is so risky in such a way that it would create aerosols or droplets that put us at risk of getting infected with that disease.
According to the World Health Organization, in the Western Pacific region, the Philippines has one of the highest number of medical staff infected by COVID-19.
We have what they call the supply of those resources and PPEs, but those supply immediately runs out. And to and sometimes we resort to reusing them, in the front lines. We're trying our best to combat these deficiencies by procuring enough supplies and through some donations from our donors. Philippines has one of the highest number of medical staff infected with COVID, maybe because of the enormously number of patients coming in, and that though there are protocols stated, but mostly they are due to uncooperative patients during history taking.
Patients have been known to lie about their travel history and medical conditions out of fear of being shamed for having COVID-19.
I encourage everyone to do their part by staying at home while we are battling this virus, while we are on the front lines.
The message to Filipinos is clear. Stay at home to stay out of hospital. As simple as it sounds, it remains a feat for people like Christy.
Maglisod mi pangita og trabaho. Nya way sigurado among kwarta. Di pod paigo ang hinabang sa gobyerno. Wala kadawatanan unsaon kaha ang pag-eskwela sa mga bata. Di man pod taganahan nga matakdan sila og masakit.
The strict lockdown was lifted on June 1st, and quarantine measures have eased to revive the economy. Industries like manufacturing, retail, food and beverages, and others are operating with health protocols in place. But the government has not reached their goal of testing 1% of the population, and there are concerns about undetected cases.
Community quarantine, home isolation, hand washing, work from home options, these things are helping. If you relax too early, you could see the transmission going to our vulnerable group.
For Christy and her family, living hand to mouth meant the daily hustle was their only means of survival. The pandemic has made their difficult lives even harder. But she has not lost hope.
Kad pa jud mi sa una, pobre na jud mi. So na lang ni dako ko. Mao Japon, pobre. May na lang gani pohon, akong mga anak, eskwelahon ako og tarong. Ya, patarongon jud ako eskwela akong mga anak pohon lang di dili pa iparihan ako nga sekandera ko kutob. Nga lang gani kung maka-eskwela gani ni akong mga anak, makalingkawas mi jutay.